Hello class and welcome to another exciting facilitation for this semester. I am Dr. Annie George, Department of Public Health, Faculty of Health Sciences, and will be your guide. Hope we all enjoy it. Thank you. So on this week discussion, we'll be looking at topic 2, etiology, epidemiology, and predisposing factors of non-communicable diseases. At the end of this lesson, we are expected to know what etiology and epidemiology of non-communicable diseases are, as well as predisposing factors to non-communicable diseases. Etiology of non-communicable diseases usually doesn't have direct cause and effect relationship situation. Is usually a factor of the individual behavior, his genetic makeup, and the environment where he lives. So we'll look at these as what we call risk factors or predisposing factors to non-communicable diseases. This is as against communicable diseases where you have a direct cause relationship. In non-communicable diseases, it's not like that. In the next slide, we'll be having an activity. I want you to look at the slide and take some time before we continue. So activity 1, what are the components of the environment? As we said, non-communicable diseases, looks at those individual behavior, like unhealthy choices we make, our genetic makeup, and then the environment we live in, as things that make us susceptible to non-communicable disease. So what are the components of environment? So the environment is made up of the physical environment, which is the air we breathe, the housing we live in, the chemicals and gases in the air, and then the social environment, which constitutes the family, the socioeconomic status, like are you poor, are you rich, what is your educational level, the employment status, are you gainfully employed, and the cultural practices of the people. These make up what we call the social environment. Then we have the biological environment, which is made up of the microbes, that's the microorganisms, the plants and animals around us. The biological environment is mostly a factor in communicable disease causation. In non-communicable diseases, it focuses more on the physical environment and the social environment. Usually, there's what we call the origin of non-communicable diseases, which is usually attributed to a couple of things that are, maybe grouped as maybe nutritional due to excess or lack of some nutritional components in the diet, leading to some diseases we'll call goiter, scurvy, or nutritional rickets, or as a result of malformations in the womb when a baby is being formed. You could have hydrocephalus or spina bifida. Some non-communicable diseases are also of psychiatric origin, while some are due to intoxications like alcohol, liver disease, and all that. And then some are due to cardiac dysfunction like hypertension, heart failures, and coronary heart diseases. Some are tumors like cancers, benign diseases, and some are hormonal in origin like diabetes. Some are due to occupational and degenerative diseases, and of course accident like road traffic accident, domestic accident, and what have you. Now, we've looked at causation in non-communicable disease as, not having that direct cause and effect relationship, but due to what we call risk factors or predisposing factors. So now we will look at the epidemiology of non-communicable disease in terms of its distribution, global distribution, mortality, and morbidity. So non-communicable diseases kill 41 million people yearly, which is equivalent to 71% of all global deaths. Every year, 15 million people die from non-communicable diseases between the ages of 30 and 69, with over 85% of these cases in low and middle income countries. Cardiovascular disease is usually the first in the pack with 17.9 million deaths annually, followed by cancers with 9.0 million deaths, respiratory diseases 3.9 million, and diabetes 1.9 million. These four diseases that I mentioned constitute what we call over 80% of all premature deaths due to non-communicable diseases. The use of tobacco, physical inactivity, and harmful use of alcohol and other unhealthy diets that we take usually increase the risk of dying from non-communicable diseases. Early detection and screening helps in controlling non-communicable diseases. Early treatment, palliative care also helps in responses to non-communicable diseases. In the next slide, we'll be looking at another activity. I want you to take some time and then before we continue. Activity 2. What are predisposing factors? So predisposing factors are those factors that are actually present in an individual that contribute to the development of a disease. They are as well called risk factors and can be classified into modifiable behavioral risk factors like tobacco, use of tobacco, physical inactivity, harmful use of alcohol and other unhealthy diets. And then metabolic risk factors like high blood pressure, high blood sugar, high blood cholesterol, overweight or obesity. These are what we call metabolic risk factors. So we've actually looked at the etiology of non-communicable diseases as not having that cause and effect relationship. We have understood what the global trend in the epidemiology of non-communicable diseases are, and then we've also learned the predisposing factors or risk factors to non-communicable diseases. In the next lecture, we will talk about signs and symptoms of non-communicable diseases. Thank you for listening.